in the community, right? If we're trying to come up with a business plan, how do we justify that, right? You okay? Okay. How do we justify our services, and then how do we come up with a business plan? This is kind of what we have to do here now. Okay. So we'll talk about how to plan and justify patient care services, discuss various reimbursement models, right, for pharmacists, discuss the various elements, including, a business plan. Here we go. Numerous studies have shown that pharmacists can improve patient care and outcomes. Give me an example of, pharmacy service that, we've improved patient care and outcomes in retail. I don't talk about retail. Immunization, MTM. Now we can do what? Pharmacists, we can prescribe, right, under a doctor. What can we prescribe?
Maintenance medication.
We can?
Wait, no.
Oh, it is.
is.
Okay. In the hospital, not in retail. And we're talking about retail. I'm a retail guy, so 100 maybe you can do that, but not on the exam. Make sure you don't put that. All right, so we can do Paxlovid right in retail now, right? Anything else? Birth control and some. Birth control. Right. Okay. Did y'all know that or?
Okay. Texas, right?
Say it again now.
Is it in Texas or general?
You tell me. Where can we prescribe birth control?
Yeah, it's in Texas.
You sure?
Yes.
You sure? So a CVS pharmacist can write a prescription for birth control.
Yeah.
In Texas?
You know, Hot Wheels is not long enough for you.
CVS did say that they can prescribe like Paxlovid and.
You talking about birth control? I didn't say Paxlovid. Birth control. Can we prescribe birth control? You think so? Okay. Well, you see it on the exam? Yeah. Okay. Therefore, pharmacists. Have you seen that, Anthony? Have you seen Calandra do birth control? Right. Therefore, pharmacist patient care services have been implemented in many practice areas. Here we go. And then to financially support services, pharmacists need to understand, right, how to justify and plan for patient care services. All right? So let's talk about it. It's something called this needs assessment, right? So it's how do you clearly define the need being addressed by for your services. For example, we talked about innovation, right? Always find the problem, and then you can maybe come up with well, not necessarily a solution first, but like, hey, there's a need for us to be able to have pharmacists to prescribe Paxlovid. Why? Why was that a need? Who can?
Because
Why did they give pharmacists the ability to do that? Why do you think? The government said, go ahead. Why? Okay, so what happened? Why did they let the doctors do it? But how? Why did they give it to pharmacists? Why didn't they give it to?
Because they're the ones on the front line coming in contact with everybody coming to the doctor's office just to get a prescription to treat COVID.
A little bit, right. So we're the most accessible, healthcare provider, right? Everybody else has to make an appointment. Pharmacists, you can just go walk right in. So that's why. Accessibility, right? So that's that we saw a need, and we actually get paid a premium to do that. So we have to collect data to assess the need for a particular service or product within a defined population. You okay? Yeah. Okay. Or community. 3 basic questions, right? What is the patient's need or problem to be addressed? We just talked about it. How large is this problem, and what are the trends, and how well is the patient need currently being addressed, right? So that's, a few things that they, you can look at when you're doing like a needs assessment. What is the patient need or problem to be addressed? Let's look at that. It may be related to disease prevention. We talked about COVID, disease management, medication access, and pharmacy services access, right? It could be identified in, the pharmacist's normal course or education. All right, this is pretty self-explanatory. Primary research. What is primary? Have y'all had Indefo? I have had Indefo. She talked a lot about primary research, right? What is primary research? Like, what is that? Is the textbook is primary research?
That's conducted in institution.
Institution. Is that it?
Original research conducted
That's right.
for the purpose of answering a specific.
Right, so know the difference between, this will be on the exam. Look at him writing now. That's sad. You ain't write nothing else. Now you want to write what's on the exam. Know the difference between primary research, right, and secondary, etc. This is original research conducted for purposes of answering very specific questions, right? include, medication profiles, chat reviews, patient surveys.
Charts.
Charts, excuse me. Chat reviews, I said it wrong, personal interviews such as stakeholders, focus groups, and observation studies. All right, secondary research, right? Know the difference. Will be on the exam. Research that has been already conducted for, another purpose and is publicly available. Literature, web searches, etc. Okay? So, how large, is the problem? Use research to quantify the problem and determine the trends, right? Helpful to use secondary sources to extrapolate the size of the potential patient base to the community being served. Okay? That's how you look for the need. How large is the problem? You can look at different trends, right? Secondary sources can provide data, and incidence rates. I'm sure Dr. Mature talked a lot about that. Mature, right?
Yeah, he said so.
Should also consider future goals, right? And know whether the patient base or other relevant factors will increase or decrease or reduce. Alright? This is pretty self-explanatory, right? So how well is the patient need currently being addressed? Typically, a patient care services addresses a significant unmet need. Can y'all think of a need? Maybe I've got a few on my mind. Can y'all think of a patient need right now, that's probably not being addressed, Can you think about that? Say it again now? I didn't hear it. What did you say? Oh, who said it? I thought you had the answer. You didn't need a patient. What is the need? What's the need like in the world? Like, what do you think we could, if we stop this and we had a drug for this, boom. Okay. Diabetes is not controlled.
You said cured.
No, I said a need. Like, what's the need right now that's everybody is, you came up with it.
A cure for COVID.
Will we cure COVID? I mean, will the flu ever be cured? Like, why do you think the flu won't ever be cured? Because it's a virus, right? And it changes different things, right? So you said pain. Can pain be cured? If I get slapped right now, can you cure me with pain? Let's try it. Who said that? Get out. Get out. Huh? You can control the blood pressure, like getting it down, or what you want to do? It's control.
Control.
Give me something else.
No, if you have
My teeth, you okay?
Yes, sir.
You need to leave? You okay? You need to step out? You okay? I don't want you to be mad at me. You mad at me? Oh, okay. Jada did? Oh, tell her I said what's up. Yeah, no, I'm kidding. All right, think of a need. So this is your business plan coming right now, right? You should be thinking of a need. That's what you should be thinking about. What is needed in the world? What can I do to create, to bring the health to the world? What about hair loss? What about that? That's a good one. If you
So what you do?
For like the,
Huh?
for like the chemo patients.
How about anti-aging?
Anti-aging? What do you mean?
It is all about.
Somebody said I was, let me address this. She said I was 40 something. I'm not 40. Do I look 40? You said that too. Do I look 40? Wow.
They said assault and physical.
I'm just saying. I'm not saying there's nothing wrong, but I'm really young. Maybe that's not one. What you think? I'm trying to help y'all. Y'all not feeling me. Acne. Okay. Okay. That's kind of control, right?
No.
You can cure acne?
No.
Give me that.
You can't.
No, if somebody.
That's what I said. It has to be controlled, right? Because that's
So
on
control or curable?
You tell me. What do you think? What's the problem in the world? What's the problem? Give me a problem.
Like a medical.
Okay.
Poverty.
Insurance. Oh, I like that one.
Hunger.
I see she did.
How about genetic problems?
Let's talk about health insurance. Can we help everybody with health insurance?
No. I mean, you could help them with something.
Tuberculosis.
Okay. Y'all not feeling me. Y'all not. You have a business plan coming out where you're going to have to do this. I'm helping you. Let's talk about it.
But you're not giving us no idea.
I'm the teacher. I don't have to give you the answer. Just think about it. Y'all have to come up and be creative. Maybe. What about asthma? Can you cure
environmental factors.
So how you gonna fear that?
Stress. How about stress?
Climate control.
Stress.
Good luck with that.
Your goal is to come up with a problem, a need. And you can look at how well is asthma being controlled. Let's use it. How well is asthma being controlled today? Is it working? Are the stuff working? I think it's working. I take my little buffer when I'm running and I'm good.
How about HIV?
HIV?
You can't stop people from doing.
Can you?
Okay. How well is it?
Yeah, it is controlled.
The viral load ain't going up in some of these patients? No.
It's non-detectable in some people.
Magic Johnson.
No, actually, they reported this week. They actually reported this week, somebody in one of these European countries, he has been undetectable for 4 years. And they were like shocked, so.
Trying to help. Y'all not listening. Trying to help. Well, I'm trying to help y'all come up with some ideas for your own project. Y'all gonna have to do this, right? So think of a need. Think of what's happening in society that you can, kind of focus on. All right? I don't have any answers. I do, but what I did was I said I knew like the world was kind of going to like digital. I thought of a commercial that I could come out with. I probably still have it.
Share. Come on. Pull it up.
Maybe.
No, yes, I think she said she wanted MTN.
My commercial was, no, I did a talk show, excuse me. The talk show was doing MTM, so people come in and do like a blog. I got 100 and I ain't Here we go. You have to be able to justify your service, right? You have to be able to justify your service, right? So after you find the need, you have to do that SWOT analysis. What does the S in SWOT mean? Stress. Who said that?
Strange.
Oh, I thought you said stress.
Strength.
Does it mean study?
No.
Okay. Does it mean what else?
Determination.
I put 4 of them. Make sure you put the right one.
She said song.
Determination.
Oh my God. Get out. Okay. All right. Evaluate the internal strengths of the organization, right? When you bring your business plan. Understand the internal areas of weakness. Identify external opportunities that will allow service to grow, and then understand external threats. Okay? You guys understand? Most companies do this SWOT analysis. Seriously, I had to do it for my district, so we all do that. All right. So results of this SWOT analysis should what? Provide objective data indicating whether to support or not support proposed services. Right. So be communicated, to the stakeholders. Right. So we say, hey, here's where we're at. Here's what I figure.
You gotta move up closer.
I got to move on. Try to be nice, try to be cool. All right, here we go. So useful strategies, guys. Useful strategies. Useful strategies to justify services are to show how the services will increase revenue. It's all about money, right? Decrease costs to stakeholders and customers, improve outcomes. You got to be able to show that. Here we go. Pharmacist patient care service and scope of service should be well defined. There should be no uncertainty, right? How or if it will affect, patients, referral of patients to this program. Clear services plans will help efforts to meet, again, legal requirements. This stuff is pretty self-explanatory. Do we need a mission and a vision? Right? We do, right? The mission describes the purpose of the program. The vision describes what the program wants to achieve. That would be the question on the exam. Okay? The mission does what?
Describe the
Describe the
purpose of the
purpose.
program.
That's right. So describe the purpose, and the vision, it kind of tells you what you want to achieve. Let's look at TSU's mission. You guys read this when y'all graduated? No? Okay. So this is the mission. Texas Southern is a comprehensive metropolitan university, blah, 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 opportunities for public service, blah, blah, blah. Right? So it just kind of goes on and talks about the purpose of why they want to be here, with this. This one says, hey, we will become one of the nation's preeminent comprehensive metropolitan universities who will be recognized. Do y'all feel the difference with the vision? The vision is like, rah! And the mission is like, here's what we want to do. Y'all get it?
Chitty said it looked like they need glasses because the vision not clear.
I don't know why you keep, is that what you're saying?
That's what she texted me.
Let me read the text. Okay, so why y'all, TSU's a great university. Why y'all come here if y'all didn't like TSU? I think they have problems, for sure. Yeah, they will have problems. But I think it's a good university. All right, so any questions on the mission? Any questions on the mission? All right. Here we go. Well-defined, I'm almost done. I got just 50 more to go. Well-defined program, right? You address interests of stakeholders, right? Why are we concerned about stakeholders in business? What is a stakeholder?
They are the one, the financial people.
They're decision makers.
The money maker.
Wrong.
No.
Someone that's invested a certain amount of money.
That's right.
Yeah, that's what I said, the money maker.
They're not the money makers.
Shareholders.
They're investors, right? So they're also the investors. There's some other stakeholders that may want. What do they want? What do the stakeholders want?
To make
What's it?
money.
Okay, so somebody who came up with what do you think? What do you think they wanted when they said, "Hey, I'm gonna give you $100 million"? What do you think they wanted?
They need money.
A profit.
Profit.
They wanted a return on their investment, right? So that return on the investment could be with money, it could be with more stocks, it could be with a portion of the proceeds of everything. Okay, so that's how we got it. It's always important to note that stakeholders, right? Key financial areas, right? Financial survival, right? Our key areas: financial survival, growth, improvement, overarching organizational goals. The market is dynamic. It's always, changing. It's improving. We need to maximize, right, on the competitive edge. Here we go. There's two distinct components of organizational structure. There's program and reporting. Let's look at it. So policies and procedures where you got to know that, right? It's guidelines for operation of the program to assure a standard of practice and consistent level of service. CBS has policies and procedures. We have one. I just went over it with my team. If you're late, to open up my stores, if you open up late, and that's 1 minute, you'll get a ding. I ding you once. If you got two of them, you got one absence. If you do that too many times, I write you up. That's just the policy. So if you can't be late to open up the stores. Guess what I find? Who's the people that are most late in pharmacy? The technicians. They're late. Oh, I don't care. I'll come when I want to. Right? So we have policies and procedures. Every company has policies and procedures for this, right? This collaborative practice agreement. What is this? It's an agreement where a prescriber authorizes a pharmacist to do what? To do whatever, right? To perform certain duties under their jurisdiction, right? Okay? Must conform to state pharmacy practice laws, just like birth control, which will be on the exam. This agreement, it goes through different stages, right? 4 different stages. Not important. Don't spend time with that. Okay? It should include information and policies and procedures, modules, drug therapy management protocol. Copies should be signed and kept, by the pharmacy and the physicians at the physician practice. All right. Staffing, right? Develop human resources plan to meet service staffing needs. So when you're coming up with your business plan, which is going to be great, you're going to raise money, you're going to do all these MTM. Make sure you talk about your human resources department, like how you're going to, address staff and address, different other things, right? Number of individuals needed, roles and responsibilities. Expected time commitment. How many people y'all in the group?
About 4.
It's only 3 or 4? 4. Okay. All right. So, make sure everybody has a role, while y'all doing y'all's yeah. If you didn't document it, you didn't have it.
Do it.
All right. So, make sure you guys are documenting, as it relates to, your HR format, right? Format can be unstructured, but more commonly structured. For example, the SOAP method. Y'all know what the SOAP method is?
Yes.
What does the O in SOAP mean?
Objective.
You know that. All right, reasons for documenting. Reasons for documenting, right? Why should we document?
See why?
Communication with other healthcare providers, It's a legal record. It's a marker for critical thinking, justification for reimbursement, data collection. I remember I worked at, I did a rotation at Harris Health, and I had to document, I had to do all these spreadsheets and all this stuff, but I had to document how many times these pharmacists used to provide MTM services. This is when it first started to come around, I think in 2014. And, you know, I think 2013 or something like that. And so we had to document all these MTM services, and it was laborious, but, you know, that we needed it for reimbursement, you know, for that. All right. Program evaluation. Look, you know, the company's looking for quality, right? Characterized by patient outcomes, reflective of process that convey current standards of practice. All right. It's essential that all pharmacists, you know, patient care services plan and implement ongoing evaluation and quality improvement programs. So when you guys are writing your business plan, you got all these ideas and things, make sure you have a checkpoint, a data point. Y'all sleeping and okay. You gotta have a checkpoint. You gotta have a checkpoint to see if it's working. All right, very important. This ECHO model. What is this ECHO model of evaluation? It looks at economic outcomes, clinical outcomes, and humanistic outcomes. What is economic outcomes? What is that looking at?
Looking at the financial.
Financial, right? So looking at financial outcomes, are we making money? Are we profitable? Clinical outcomes look at if the product is working, what's happening, patient population. And then humanistic outcomes, what is that?
Is that?
What is it? Competition.
No.
Providing
The
customer
services
service.
in services.
Okay.
Maybe the strength.
You're not looking that up. What is a humanistic outcome? What is that? What is that? What is it? Prevention. Religion. Well, I don't think this is.
Consequences of disease or treatment on patient functional status or quality of life.
Payment, right? We have to justify how we're going to get paid, right? Demonstrating ability to be paid is vital to this. So when you guys are writing your plans, right, you're coming up with this MTM service, how are you going to justify, hey, I need $200,000, you know, for it, right? So writing, you know, being able to demonstrate that is very important, right? The best service may not be viable, if it cannot be financially stable, all right? Very important. Okay. Right there. Most pharmacy services. Most pharmacy services have relied on product-driven model for payment. What does that mean? What is a product-driven model, right? So it's always linked to, you know, dispensing of a prescription, you know, for pharmacists. So they get paid based on how many scripts we do. CVS looks at how many scripts, you know, that each store produces. We have a budget. If you met your scripts, you know, you get paid high. If you don't meet your budget, you decrease the hours, right? We talked about that. But this is a product-driven model. It depends on gross margin, overall cost of the medication, etc. So we look at that. Payment to pharmacists for services as a transaction separate from dispensing, right? So the service-driven model. So they're saying, hey, you know, if I'm a pharmacist in the retail setting, who's going to pay me for doing a consultation? How much money do I get for that? Zero. Why? Because that should be already, you know, that's your work today. It is what it is, right? And Texas has in the law that you guys just learned from Dr. Jones, can you not counsel?
No, you must counsel.
You have to counsel, right? So you got to make sure you're doing that. But we don't get paid for that service. You don't have to record me. It ain't that deep. Yeah, the exam is gonna be easy.
I didn't know it was.
Yeah, I'm not that important. I'm not that important. Yeah, come on, just listen. So listen. The pharmacist is trying to now definitely separate their ability to not get paid for each bottle that they have because they're more important than that. You guys understand that? No? The pharmacist is trying to separate their service that they do without dispensing, right? And just the general ability for them to answer questions and you know, especially in the retail setting, how do you quantify how much money I'm spending, you know, out and giving these consultations? How do you quantify that?
Are you taking the time off the queue?
You take the what now?
Are you taking the time off the queue?
You asking me? Yes, we're not paying.
I was referring to the script because you have the consultant for each script. I didn't get paid for each consultant for each script.
I like that. That's a good need. You can write a good program based on that. I like that. How do we pay for services in this model, like in retail? How do we put a service transaction or something on that? And you write a whole plan on that. That's a need for pharmacists. Who's in her group? That's right. That's right. Yeah, you done. All right. So now you just listening to us. Okay. All right.
Sorry, Mayor, Jonathan.
All right. So costs can be fixed or variable. Know the difference? So fixed costs occur regardless of volume of service. So what's a fixed cost in retail? What's a fixed cost in retail? Hourly rate. Perfect. All right. It is what it is. It don't move. It don't nothing happen. Okay. What's a variable cost? Bonus. I like him. Come on, give me some power, man. I like him. He said bonus. Every company is bonusing on March 15th. Don't ever forget that. If you're part of a big corporation, they bonus on March 15th. Every corporation. Why do they bonus on March 15th? Who can? Obama. Oh, because we bonus because of her birthday? No.
Quarterly, right?
Because of what? Before taxes. No.
The quarterly?
Because the first quarter, the company.
Quarterly.
What happened?
So it's the quarterly, yearly quota, right?
That's it. So we have to submit our quarterly. Every company submits their quarterly earnings to, around that time. So we try to get that. Amber. Why did I say nothing? I didn't say nothing. I didn't even notice you. I didn't even notice you. All right. Don't forget March 15th. I may put a question on that on the exam.
You gonna share? So the bonuses.
All right. You guys, hey, listen. Let me make sure y'all clear. The purpose of this class is to teach you concepts when you go out in the world. You don't have to memorize all this, but go into the world and not being able to learn these concepts and understand. That's it. You're pharmacists, you're doctors. You're not going to use probably 1% of most of this, but just listen. Try to gain some understanding. All right?
How do you determine the bonus?
That's a good question. So CBS determines it based on how well we do on our metrics. So if we hit our scripts, right? The percentage of scripts, we hit different metrics. My bonus last year was like, I don't know, maybe like $500,000.
What you do with it?
It was close though. Retail bonus is the best. Hospitals, they don't do that. Okay, so direct billing. Pharmacist submits bill directly to the patient or third-party payer. Pharmacist submits bills directly to the patient or third-party payer. Okay. Pharmacist is the provider and is paid directly for the service. Right, depends on the patient's or payer's willingness to pay. Patients, right, should be informed of fees and terms of payment prior to the service received. Indirect billing. So this is, most of retail. We do this. Pharmacist submits bill to this Medicare. They give us private insurances, and then so you got to find out which way you want to be billed when you're writing your business plan to help the pharmacists. I like that. Figure out. I like that. How you gonna? We gonna have indirect billing, or we gonna have direct billing? Think about that. Hire you. Okay. Okay, Wes. define services by cost avoidance. What is this cost avoidance, right? Actions taken to reduce future expenditures, right? Such as pharmacists providing interventions that improve diabetes control, resulting in reduced hospitalizations, right? So this is saying, hey, if I protect everybody with this COVID shot, no, there will be less hospitalizations, less insurance things, right? Let's go ahead and give everybody the COVID vaccine for free. That's an indirect, kind of a cost avoidance measure. Okay, don't forget that. Okay, y'all follow me? Okay. Okay, it may be higher in the short term, but you save money in the long term. Insurance companies do this all the time. Right? Insurance companies do this all the time. Car insurance does this all the time. How do car insurance do this all the time? How does car insurance? State Farm, how do they do it?
They require you to have a liability insurance?
No. That's it. So they say, hey, you're gonna pay me every month. You're gonna pay me every month if you have an accident or not. Right? It is what it is. Right? You're gonna pay me or not. If I have an accident, it is what it is. But the day you have an accident, you're what?
Jack you up.
But you're covered though. You know what I'm saying? You're covered. You know what I'm saying? Y'all not understanding? Y'all. It's gonna be on the exam. That's all y'all care about. Business plan. Here we go. It's the formal document. This is it. The formal document that contains the background information about the intended opportunities, the key participating members, and describes in detail supporting information concerning this attained goal. Success for the business plan is generally greater for those who have a solid business plan bolstered, right, by good data and rigorous research. So did Farrah do her her due diligence, looking at all this data, to pull from? I don't know how you're gonna get data, with that, with your project. I don't know how you're gonna do that.
We'll figure it out.
Okay. Okay. The business plan are decision-making tools. Okay. They should include and assist in developing. The benefits of a business plan should assist in developing a concept, right? Unique niche in a stable, growing industry. Help to focus on goals and objectives. Identify that SWOT, and that analysis assessment. Serve as a selling tool, right? Provide your business plan to the what? What kind of holders?
Stakeholders.
Good business plan cover at least 5 content areas, right? It talks about the background, general information, marketing, right? That's important. Operating, right? Finances, and discussion of decision-making criteria. Okay, any questions on any of those? Okay, the first plan is this executive summary. Did she go over all this with y'all? What is an executive summary? What is that? It summarizes what? Kind of summarizes the business plan. It's like thesis. Here's what we're trying to do, right? It could have a part of your vision in it. She okay? She's kind of sleeping though. Your eyes just kind of hit. You waiting for me to come on? I'm grinding. I'm jump across the. Good God. You gotta, go to sleep, but don't do the whole. All right. Executive summary. At least Latifah is laying it off. She said she's sick. Latifah said she's sick, so she's sleeping like that. All right, so executive summary. Remember, this is a brief summary of the highlights of the business plan and should be less than 2 pages. You ain't sleeping now. All right, make sure you guys are understanding that. Very important. That's your business plan. I can't wait to see y'all. Just the summary. So the summary should be very quick. It shouldn't go into detail. All right. I'm not going to change something. Provide data that defines and describes, you guys understand that. We talked about the mission, right? Products products and services, we talked about that, right? Clearly describe products and services that the business will provide. That was my issue, I remember, on my business plan. I didn't really have a product. I just had this commercial that I was gonna do. A talk show, I'm sorry. I just had a talk show. And there was no service, it was no. It was a talk show. I'm gonna show you. I did a commercial of it. It was a commercial? It was a commercial for the talk show.
So did you get all that?
Yeah, I did the whole, it had like 20 pages, yeah.
Was it longer than 15 minutes?
No, I was smooth with it.
Because I heard you did that.
That's
What was
it.
your grade?
I got hundreds and all.
That you-
Don't do it. I don't think it was good. I said I got paid. Alright, hold up. I'm almost done. Just a few more slides. Only 20 more slides. Market analysis, right? Market analysis, the systemic investigation of structure and opportunities of a market, right? It should include a description of the industry, the specific sector of what business you intend to compete in. Again, that's SWOT analysis and a competitive analysis, all right? You gotta have a brand. You gotta be able to identify a target client, right? And effectiveness in developing successful campaigns to attract patrons, all right? Very important. Okay, operations and management, we talked about that in the HR portion, describing key elements of a business operations, right? Management, personnel, organizational structure, work environment, workflow, resources. Make sure you guys. Talk about finances, economic assessment, the conclusion, right? Conclude a brief summary, right? That highlights the critical elements of the plan. Be creative and passionately communicate your plan to stakeholders. A business that succeeds generally brings something unique to the market. Very important. And that's all I got. Okay, any questions? On the business plan, hold on. The business plan is like 85% of y'all grade. How much you say? 50%? It's a lot. Any questions on that? Trying to get y'all to think of a need. Any questions? Any questions?